It is important to review the daily Alzheimer's caregiving tasks that are performed by family members to have a better understanding on how much effort and care is required from them. Alzheimer family members require help with instrumental activities of daily living, such as household chores, shopping, preparing meals, providing transportation, arranging for doctor's appointments, managing finances and legal affairs, and answering the telephone, even, right? The caregiver also helps a family member take their medications correctly, either through reminding them to take it or by directly administering the medication. The caregiver is also responsible for helping the family member to adhere to treatment recommendations for their Alzheimer's and any other common comorbidities. The caregiver also assists with personal activities of daily living, such as bathing, dressing, grooming, and feeding, and helping the person walk, transfer from the bed to the chair, use the toilet, and managing incontinence. The caregiver also manages the behavioral symptoms of the disease, such as aggressive behavior, wandering, depressive moods, agitation, anxiety, repetitive activity, and nighttime disturbances, which also disturbs their rest and their sleep. Even if the caregiver wants help, they must also find the time to find and use supportive services such as support groups and adult day service programs. They are also responsible for making arrangements for paid in-home, nursing home, or assisted living care as even a last resort. The caregivers must also assume additional responsibilities that are not necessarily specific tasks, such as providing overall management of getting throughout the day. Some of these, for example, like addressing family issues related to caring for a relative with Alzheimer's, including communication with other family members about care plans, decision making, and arrangements for respite for the main caregiver. And lastly, providing emotional support and a sense of security to the family member. Here, the figure below provides a visual representation of the proportion of caregivers of people with Alzheimer's, which is depicted in purple, versus caregivers of other older people, depicted in green, who provide help with specific activities of daily living. Overall, a higher percentage of caregivers provide assistance with all activities. A higher proportion of caregivers that care for patients with Alzheimer's, right? And this includes getting in and out of bed and chairs, getting dressed, bathing or showering, feeding, getting to and from the toilet, and dealing with incontinence. I hope after reviewing the health needs of family members with Alzheimer's and the extent of the caregiving tasks, we really understand why the depression and anxiety rates are so high, and encourages us to support and provide more support for the caregivers, especially since the older populations are only going to increase, and this will include our own loved ones, our grandparents, and our parents.